This is Dr. Ali, and today we are going to talk about vitamin E. Vitamins are a group of organic compounds which are essential for normal growth and nutrition. They can be required in small quantities in the diet because they cannot be synthesized by the body. Let's talk about the history of vitamin E. The active vitamin was isolated from wheat germ oil in 1936 and was given a name tocopherol. The word tocos means childbirth. Pherol is the alcohol part in it. Initially, studies on animals show that its deficiencies result in infertility. Therefore, it is called as anti-infertility vitamin. But now, it is known as the most active antioxidant vitamin in the body. If we look into the chemical nature of vitamin E, they have a chromatin ring system with an isoprenoid side chain. There are about 8 naturally occurring tocopherols called alpha, beta, gamma, delta, and so on. Out of all these, alpha tocopherol has greatest biological activity, which is chemically 578-trimethyltocol. All different types of tocopherols are methyl derivatives of tocol compounds. Vitamin E is absorbed from small intestines along with other fats with the help of bile salts. Only 40% of the amounts ingested is absorbed. They are absorbed and transported as chylomicrons. Once the vitamin E is absorbed, it is mainly stored in muscles and adipose tissue. But to a lesser extent, it is also stored in pituitary and adrenal gland. Very little amount of vitamin is excreted through urine and feces, while mainly it is excreted in a milk of lactating females. Vitamin E occurs in nature as yellow oil. The two main sources of vitamin E are from animals and plants. If we talk about animals, they are present in egg yolk, milk, liver, cheese, and butter. Whereas in plants, the main source is from the vegetable oils, such as wheat oil, germ oil, sunflower oil, and so on. Vitamin E is used therapeutically as anti-abortifying agent. It also treats nocturnal muscular cramps, intermittent claudication, fibrocystic disease of breast, and atherosclerosis. Normal vitamin E levels in the blood is 1 to 2 milligrams per day. The daily requirements in a child ranges from 10 to 15 international unit, whereas in adults it ranges between 20 to 25. The requirement increases with higher intake of polyunsaturated fatty acid.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.